Imagine you're talking to someone you love and suddenly you notice one side of their face starting to drop, or they suddenly can't get a simple sentence out right. How much time do you have to react? A lot less than you think. For every minute a stroke goes untreated, your brain loses about 2 million cells. That means every second counts. In this video, I walk you through exactly what the symptoms of stroke look like, how to recognize them in a second, and why so many people mistake them for something else. A mistake that can cost a life. Stay until the end. Bismillah ar-Rahman ar-Rahim. Hello everyone, I'm Dr. Hossein, an internal medicine specialist. What is a stroke? A stroke happens when the blood flow to the part of the brain is suddenly stopped. This is usually caused by either blocked artery or bleeding in the brain. Without oxygen, brain cells begin to die within a minute. That's why recognized symptom quickly can save brain function and even save a life. The FAST rule, a quick way to recognize it. Now we get to the most important of this video. There is a simple, easy to remember method that doctors and health organizations around the world use to help ordinary people spot a stroke fast. It's called FAST and it stands for things. Number 1. F. Face. Ask the person to smile. Does one side of their face drop or look uneven? Can they smile symmetrically? This is one of the earliest and most obvious signs. Number 2. A. Arm. Ask the person to raise both arms and hold them up. Does one arm drift downward or can they not lift it at all? One-sided arm weakness is a classic stroke symptom. S. Speech. Ask the person to repeat a simple sentence. Is their speech slurred? Are they mixing up words or unable to speak at all? This is what we call the speech disorder caused by stroke. Number 4. T. Time. If you notice any of these signs, don't wait. Call emergency service immediately. The patient should never be behind the wheels and drive themselves, even if the symptoms feel mild. An ambulance can start treatment on the way and gets you to the right hospital faster than you can on your own. Every minute matters. These symptoms usually appear suddenly, not gradually. One moment the person seems completely fine and the next they're showing one of these signs. That sudden onset is actually one of the most important clues that set a stroke apart from many other conditions. Beyond FAST, there are a few other warning signs worth knowing. A sudden severe headache with no clear cause. Sudden confused or troubled understanding what others are saying. Sudden trouble seeing in the one eyes or both. Sudden dizziness, loss of balance or loss of condition. One more critical thing while you are waiting for help to arrive. Don't give the person any water, food, or medication. During a stroke, the muscle that controls swallowing that can be afforded without any obvious sign. And giving them anything by mouth can cause it go into the lung instead of stomach. A dangerous complication called aspiration. Just keep them safe, keep them calm, and wait for the medical teams. The mini stroke, transient ischemic attack. A warning you can't ignore. Here's something lots of people don't know. Sometimes these symptoms shows up for just a few minutes and then go away completely on their own. This is called a transient ischemic attack, often known as a mini stroke. Many people assume that because the symptoms disappeared, there is nothing to worry about. That's a dangerous mistake. A transient ischemic attack is actually a serious warning sign. Research shows that people who experience one are at a high risk of having a full stroke in the day and weeks that follow. So if you are noticed FAST type symptoms that go away on their own, you still need to see a doctor right away because your body is telling you something isn't right. A stroke vs heart attack. What is the difference? One question people ask a lot is, what is difference between a stroke and heart attack? Because sometimes the two get confused. A heart attack involves the heart, a coronary artery gets blocked, cutting up the blood flow to the heart muscle, and main symptom is usually chest pain or pressure which can spread to the arm, jaw and back. A stroke involves the brain, not the heart. The symptoms are usually not painful. They most shows up a weakness, paralysis, speech difficulty, or vision problem, often without any pain at all. Here's the key takeaway. In the both case, minutes matters. So whether you suspect a heart attack or a stroke, the bottom line is the same. Get help immediately. Cause and risk factor. Now let's look at the why stroke is happen. The most important risk factor are A. High blood pressure, the single most common controllable risk factor. B. Diabetes. Diabetes damage the flow vessels. C. High cholesterol lead to plaque buildup and clot in the vessel. D. Smoking sharply increase the risk of blood clots. F. Heart arrhythmias, especially atrial fibrillation, can generate clots that travel to the brain. G. Family history and old age. The good news is that most of these factors are controllable. Managing your blood pressure, controlling blood sugar, quitting smoking, and maintaining a healthy lifestyle can significantly lower your stroke risk. Let's recap what we covered. A stroke happens when blood flow to the brain is cut off, and every minute of delay means millions of brain cell lost. To recognize it fast, remember FAST. Face dropping, arm weakens, speech difficulty, and time to call emergency service. Even if the symptoms go away their own, take them seriously. It could be transient ischemic attack, a warning sign of the bigger stroke to come. A stroke is a medical emergency. The faster you act, the better chance of full recovery. If you found this video helpful, make sure to like it and subscribe us so you don't miss more medical content like this. Thank you for watching and goodbye.